This week, New Detroit released its latest report on racial equity in our region. And as the COVID-19 pandemic made very painfully clear, there are major disparities in so many sectors, from healthcare to education to housing. And in many ways, they're really all connected. Let's go ahead and talk about it with the president and CEO of New Detroit, Michael Rafferty, and the CEO of Focus Hope, Portia Roberson. Thank you so much, both of you, for being with us here this morning. Michael, let's go ahead and start with you. Talk to us, explain to folks in a nutshell what this report is all about and as it relates to the COVID pandemic.
Yeah, well, thank you for having me here. For basic, brief context, when I came into New Detroit about a year ago, I said one of the things that we need to do is collect as much information as possible on racism. Racism is one of the biggest, most pervasive problems that we face in our country. It's one we faced for a very long time. We can't just look at symptoms and try to intervene with symptoms. We have to look at this holistically. We have to look at this comprehensively. And so we began earlier this year by pulling resources together to do just that, to collect data, to collect information and analyze it. What came out this week was the interim initial report. There will be many products coming throughout 2020. What we did, as you mentioned, is we examined racism in 6 different categories: education, housing, income, employment, and wealth, health, and discipline and incarceration. And as we were coming close to finalizing it, COVID struck, and we started to analyze how COVID intersected with each one of these categories. And by examining symptoms of racism categorically, we're able to show things like the disproportionate nature of COVID, as well as how COVID affects other categories. How COVID affects education, how it affects public health clearly, and wealth and income and all of these other things simultaneously. The next steps are for us to sit with practitioners and experts, members of our board and coalition at New Detroit, to understand what dig deeper, understand what the recommendations for each of these industries needs to be, and even sit with community groups to understand how people are directly being impacted by these disparities.
Yeah, and Portia, Michael mentions digging deeper. I think one of the most glaring portions of the report addresses how many African Americans in our community continue to face adverse living conditions. And I mean, it's something that you really have to talk about when you talk about COVID and its impact on our community.
Absolutely. I mean, I looked at the report and it's a phenomenal report. And just looking at the economic disparities is just so glaring. I mean, I think when you look at, what a white family has in comparison to what an African-American or Latino family has, it is shocking to see it on paper, right? And this is from somebody who deals with sort of these kind of issues at Focus Hope and sort of the need and the community that needs from us. We know these things, and yet it's still very shocking to see. This COVID-19 just blew it out the water in terms of health disparities and how people are living in places where, one of the things that's come out of COVID is like having a strong immune system. Well, how is that possible if you're not getting fresh food and you're not eating vegetables and fruit on a daily basis, and you're living in a place that is considered a food desert? Or if you're living in a place where, quite honestly, your water may have been shut off and you may not be able to go home and wash your hands every day in hot soapy water as soon as you come from outside to prevent the spread of this disease. So, I mean, I really think that the report was timely in so many ways. And it also, with this coronavirus pandemic, it kind of exploded all of these things we need to be thinking about. You add on some of the things that have happened in the last 3 weeks. And again, just kind of an explosion of everything that's happening right now and pointing us towards that whole disparity between communities.
Right, and you talk about disparity and you talk about shedding light. There's also the conversation that's now being had about service jobs and our community and the workplace disparities that we now see that are very, very glaring and in focus now as we talk about this pandemic.
Sandra, one of the first pictures I saw coming early out of New York was people on the subway. And this was when they were started to talk about social distancing and wearing a mask and all of these things. And people were sort of going in, so to speak, on the people who were on the subway. Why are they so crowded together? Why aren't they socially distancing? Why are all these people riding the subway? And, it took a few people to say, like, listen, for a lot of these people, this is the only way they have transportation to and from a job that they are not able to call in on, or they're not able to work remotely from. And so this is not about, somebody not following the rules or not wanting to prevent the spread of this disease. This is because this was the only mode of transportation they had. It was the same situation in the city of Detroit. We had bus drivers who were exposed. Unfortunately, we lost one of the bus drivers who, had a person who got on the bus and coughed right over him. And, a couple weeks later, unfortunately, he passed away. And so, but a lot of the people who were riding the bus also had to go to jobs. They weren't in a position to call in and say, hey, listen, I'm feeling a little ill today. I'm not going to come, because if they said that, they were likely going to lose their job.
And we'd really be remiss if we didn't touch on the factors that make you vulnerable to COVID in the first place. I know you touched on it, talking about fresh food, in many cases running water, sanitation.
Absolutely. I mean, I think Mike can talk about this a little bit better than I can, but you think about, access to health care. I mean, a lot of people in certain communities can't go for preventative health care. So they have these underlying conditions that haven't really been addressed. And so something like COVID-19 explodes in a community where people already have underlying conditions. Mike, I'll let you get in a word in.
No, thank you. No, I appreciate everything you're saying, Portia, and I agree. The minute, it must have been in February or early March, when we first heard what COVID, how underlying conditions could exacerbate mortality and the severity of COVID. And at that moment, I think, there were a lot of epidemiologists, people I would speak to, leaders in the Black community, who were all saying, this is really not going to be good. And before the data came out from the various state health departments from Michigan, Illinois, Louisiana. And, the fact is, when you drill into a place like Detroit, where not only do you have high concentration of African Americans, but you also have, as Portia mentioned, poverty. And there's so many ways that you can look at, what poverty does and how poverty intersects with public health and health quality and care. There's some 25% roughly of people in Detroit who don't have access to healthcare because of cost. And that doesn't include mobility. When we've been talking for a long time about the high auto insurance rates and what that means for the ability for a family or a person who's ill to be able to get from point A to point B. And if point B is healthcare, they're not accessing it. So, when we talk about racism, and we talk about a lot of the things that, have come up and bubbled up over the last, few weeks and few months, each one of these things needs to be examined as a symptom of racism, right? Racism is the root cause. It is the cancer that's causing all of the other symptoms. Cancer causes nausea, headache, et cetera. It's the same thing here. Protest is an example of racism. It's a symptom of it. And so, when we talk more deeply and specifically about, COVID underlying conditions, there are many, many, many more. When you look at data like what we put together, there are many more disparate conditions that end up, affecting our community beyond just those numbers.
And Michael, and you touched on it. I think this report and these numbers are just the beginning. So we're just getting the conversation going. So Michael, Portia, we appreciate having both of you on here this morning. Thank you so much.
Thank you. Appreciate it.
We're going to get a quick update on Michigan's census effort when we return.